If you are getting the audio, please yes, send yes. Okay.
Say, they say wave, yes, wave, yes. I can have a visual acknowledgement that you're hearing me. All right, that's great. All right, good. So yeah, I've been here for the past 5 years. Been here before that. I was in South Africa, and I've been out of India for possibly close to 10 years now. But it's not been an easy journey, and it's been a little rough, but that's good. But my originality and where I come from is actually India, and the northeastern part of India. I don't know if you've ever know the state of Meghalaya. It's one of the 7 sisters in the northeast of India, and I hail from there. All right. Currently, I'm a practicing obstetrician and gynecologist and a gynae endoscopic surgeon in Australia in a hospital called Armadale Health Services. Yep, that's probably it. I don't want to go into much detail. There's a lot of questions that I'll be hearing from you guys, and yeah, eager to answer some of those. I may not be accurate in all of the answers, but yeah, I'll try my best. All right, let's go. And thank you, Sanjeev, for this great meeting you've arranged.
Can we start with questions?
Yeah, thank you.
Okay, as we have already sent you all the particulars of Dr. Basil, so you can ask any query from your side. The first one, Aryanshi.
Good evening, sir. Good evening, doctor. I'm Aryanshi.
Good evening. I wish I could see who is that. You know?
I'm Aryanshi Bharadwaj from Gandhinagar, Gujarat, India. So basically my question is that what is the current situation in Australia about COVID pandemic, and what can you do for their Australia as well as India so that the COVID-19 virus can be reduced?
All right. Pretty good question. You see, I've been following the COVID-19 issue for quite some time now. In Australia, we're pretty good at it. So we have the Australian government and the Australian Health Services, and also the government health services in Australia have effectively helped in eradicating the virus. I hope you know what it means, eradicating the virus from almost of the 7 states. There's one state where there was a second wave. So I know there has been a resurgence of the virus in the state of Victoria. So Australia has around 7 states, if I'm not mistaken. Yes, it's Victoria, New South Wales, South Australia, Northern Territory, Western Australia, Tasmania. I am in Western Australia. That's the biggest state in Australia. We have no virus here. So there's only 6 cases, and all of these 6 cases, all the 6 cases are actually people who have come from abroad, and they are quarantined in the hotel. So what Australia has done is that they have got very strict border control. The border control is that whoever comes into Australia will have to quarantine in a hotel for 14 days prior to them being able to walk free in Australia. And they will be, if they have any signs and symptoms, they will be tested for the virus. And if they are found to be positive, then of course they'll be quarantined further till they recover from the virus. So the main purpose of being safe with COVID-19, which is the SARS-CoV-2 virus, is actually your self-isolation, social distancing, clean hygiene habits, washing your hands every time you go anywhere, you touch anything. It's good to wash your hands, stay 1.5 meters apart from everybody else. You've got to make sure that you don't let your hands touch your face whenever you're going out. Most of the countries have now advocated the use of the mask, which is a very important factor. In Australia, we don't have that application yet, so we don't wear the mask. But in most of the other countries, it's asked to wear the mask. WHO has recommended to wear the mask. But in Australia, it's still it's something that we can decide on our own whether we want to or not. Now in India, I can see the number of cases rising almost daily, and I think it's quite difficult to propagate self-isolation or social distancing in India, which is one of the biggest drawbacks why it is actually spreading as fast as it is can at the moment. So I hope you understand that. But for you, to be safe, I think the best thing is to always know the clean steps, always social distance, wash your hands, don't touch your hands, don't touch your face with your hands whenever you go out. Use hand sanitizers whenever possible. Wash your hands for 20 seconds with normal soap. That's proven to help in eradicating the virus. Yeah, we're still hopeful that a vaccine will come out. It may take up to 2 years. We don't know. So we don't know how long it's going to take. But yeah, some can take 2 years or more, even longer. So yeah, we have to wait.
Okay,
I hope that
thank
answers
you.
your question.
Basil, your audio is
Yes.
not clear. हाँ, इस position में you can stay at this position. Yes. Now your video is very clear.
Yeah. Okay. Can you hear me clearly? Okay. Good.
Yes. Yes. Okay, Vikesh.
Okay. All right.
Vikesh.
Hi, sir. Sir, I am Vikesh from city Srinagar.
Yeah.
Sir, I want to ask how you become a doctor in Australia, means your journey to a doctor in Australia.
Okay. Yeah. No, it's the journey to Australia. Yeah, it's a big journey. It's a long, long journey. See, first of all, becoming a doctor in India itself is a big journey, and I'm sure many of you have the aspiration of becoming doctors or working in the health services in one way or the other. Yeah, it's a big battle in India, I can tell you. We have a 1.5 billion population, out of which almost 40% of that are young people, 40-50%, who are trying and aspirating to go into the career. So you have a lot of competition there. I do realize that you have a lot of competition there in India. So so that step of becoming a doctor there, I'm sure most of you would be knowing it. It's all the entrance exams, getting into the top colleges, and then of course once you get into the top colleges, then it's going through the curriculum. Yeah, going through the curriculum of your medicine, which is actually another challenge. And then after that, it doesn't end there. So even if you specialize in India and you become a specialist, the world doesn't recognize that very easily. It's very difficult for a doctor from India or from any other country to actually migrate and then prove themselves that they are good doctors. So whenever you go to Australia, then again you have to write exams again, and you have to prove yourself again to them that this is what your qualifications are and that you are worthy of your qualification. So in total, the journey has taken us approximately 14 to 15 years. So it takes us 5 to 6 years to pass medicine. That's your undergraduation, your MBBS, your Bachelor of Medicine and Bachelor of Surgery. Following which, you have to write another entrance exam to prepare for your Doctor of Medicine or Doctor of Surgery, Master of Medicine or Master of Surgery. And then after that, some of us, we would like to super specialize. Whether you want to become a cardiothoracic surgeon, you want to become a gastrointestinal surgeon, you want to become an endocrinologist. So there are many, many other subspecialties in medicine. And therefore, you have another 3 years after that. So that's altogether 6 plus 3 plus 3. That makes it 9 years totally just in India to pass up. And after that, when you then want to move on to the US or to Australia or to Canada or to England or to any other country, I'm just going to specify in certain countries like England, the US, Canada, and Australia, or South Africa. So the US has a specific exam called the USMLE exam, all right? And then that's another exam that you have to write while you're studying your medicine, while you're in medicine, and you're passing through the 5.5 years. If you want to go to Canada, there's another entrance exam for that. If you come to Australia, there's the Australian Medical Council exam, where you have to write down while you're preparing for your AMC. As a specialist, when we become as a specialist, what happens is that some of our degrees can get recognized if you have a very good curriculum bite. So if your CV is good, so as you go through medicine, you should be able to not only, medicine is not about, medicine is not a way to become rich, just put it that way. Medicine is a way of your patient is your first priority. And that is why if you take that in the long run, you will definitely be more privileged to heal more patients and therefore have more series, publish a lot of papers, and publications make you famous. And if you have more publications, you become more you become known to the world, and that's when people start recognizing you. And therefore, even as a specialist, you may be accepted by another country to say, yes, you can come and work here because we know you and we know what you're capable of. All right. So there are different ways of getting in, but these are a few ways, and it's a very long journey. All right. So, but the first step is, of course, having
Basil,
having that aspiration, having that.
Basil, how you compare the study of medicine
Yeah.
in India and in Australia? Is it difficult or easy?
Well, you see, the study of medicine.
If any student
India
wants to pursue his study in Australia.
Okay. Yeah, I mean, yeah, people can pursue the study in Australia. There are different ways of studying medicine in Australia. One is where you can apply. You have to pay. It's a lot of fees if you come as an international student. So you can get into the Australian curriculum, where you will first have to give a test. After getting through that test, you will then have to be recruited or incorporated into one of the universities as an international student. Unfortunately, those fees are quite expensive for international students. But once you get through that, then you can, I can't exactly tell you, some of the local students itself here would pay up to $20,000 per term, you know, per year term. Yeah, per year term, you know. And if you're looking at a 5-year term, it's close to more than that, you know. So, and especially for international students, it's much more expensive. So, if you're looking for a year, it's close to $20,000 to $25,000, or maybe $30,000 per year for an international medical student.
Okay.
Pavan. Yeah. And the years, yeah, almost 6 years. Yeah.
Pavan.
Good morning, Doctor Sir. Or good evening, Doctor Sir.
Yeah, sorry, you're cracking. Good evening, Pavan.
Sir, in future, I want to become a cardiologist, a good specialist cardiologist. What are the stages to complete this ambition?
Basil, Pavan wants to become a
That's
cardiologist.
Sir, I want to know what are the stages.
That's a good dream. Yeah, great. You to become a cardiologist. Cardiology is a subspecialty of internal medicine. Right? So to become a cardiologist, you of course have to go through MBBS. Right? So you have to, if you're on your 10th exam or you go to your 12th, once you pass 12th, you go to, I mean, right now they're sitting for the NEET exams. I'm sure that's something that's called something new, the NEET. We never had the NEET when we were preparing for exams. We had the All India Medical Entrance Exam. Or we had entrance exam for specific colleges. Now, I always wanted to study in one of the good colleges in India. Now, frankly speaking, one of the few best colleges that I know of course, your Jawaharlal Institute of Postgraduate where I studied, JIPMER in Pondicherry. And of course, there's other central institutes like the Armed Forces Medical College, your All India Institute of Medical Sciences, you have your, if I'm not mistaken, your Maulana Azad Medical College in Delhi. So these are one of the few good institutes where you will have to write a separate entrance exam altogether, or the Bharat and BHU in Banaras. So all of these you'll have to write your own entrance exam and then get into the MBBS program. Once you get into the MBBS program, pass through it, the next step is then to specialize in internal medicine. So if you want to become a cardiologist, you've got to specialize in internal medicine. That is, you're not looking into the surgical background, you're going to go into medicine. Once you finish your MD, that's internal medicine, then you got to subspecialize and you get your MCH or you get your DM degree. It's called a doctorate of medicine, which is a PhD degree in cardiology, and that's when you become a cardiologist. So it's close to 6, 7, 8, 9, 10, 12 years in total. If you do not keep a gap, 12 years in total to become a cardiologist from the day you enter medicine.
Thanks,
All right?
sir.
Okay.
Basil, one interesting question comes, and the student asks,
Yeah.
can Dr. Basil sing and dance? Are you interested in singing or dancing or just medicine?
No, we are interested in many things. You know, we have a lot of hobbies. Yeah, I mean, I'm telling you, once you going, don't. What I always say.
Actually,
in India, let me put it this way. In
actually,
India,
perception is
let me put it this. Yeah.
Actually, perception is there that doctor is not for singing, dancing, or something like that. Doctor is a serious profession. And one student right here,
No.
can Dr. Basil sing and
No,
dance?
no. Of course, I can sing and dance. It's been my passion to sing a long time ago. I mean, ever since I've been, let me see, since the age of 14 or 15, I've been singing a lot. All right. Now, let me put it this way. I mean, in India, we are also geared up to complete a task. Like when you say you want to become a doctor, I'm going to put everything in hold, and I'm not going to do anything. I'm not going to enjoy my life. I'm not going to go out. I'm not going to see movies. I'm not going to sing and dance. No, you're living your life. All right, let's put it that way. You're living your life, and the dream of becoming a doctor is a part of your life. All right, live it. All right, because what you live now, you will never get again. You will never get back your younger ages of being in class 10 or 11 or 12, hanging out with your friends, and going out to see movies together or singing in a band. So I enjoyed it. So I liked it. And when I was in medical school, I never gave that up. I never sat down with my books all the time and read everything because you can't be a doctor just by studying books. You know, you've got to see patients, understand them, but you've also got to live your life. So we had a rock band in our medical school. I was a part of a rock band, and we performed on stages, and therefore we had inter-college competitions, and yeah, we were pretty happy, and we had a good team, and we are going to rejoin again in 2021 in Pondicherry. The whole band is going to rejoin again to give another performance in our silver jubilee. So yeah, we haven't given that hope up. And right now we are still practicing online. So yeah, singing, dancing, and performing is something that you would like to do. You should do it. You should not I mean, my wife is also a doctor. She's also here. And she is Sanjeev's, should I say sister-in-law? I mean, no, not sister-in-law, a sister. Let's say, yeah, he's a sister. I'm getting that mixed up. You know, Sanjeev's sister. I mean, wife.
I will tell her. I will tell all.
My wife's sister. Let's put it that.
Okay, Mahima.
Yeah, what are they? I mean, I don't know how you put that in Indian terms.
I will interpret it. Mahima.
Good evening, sir.
Yeah.
I'm Mahima Garwal from
Good
Delhi.
evening.
Sir, it's my ambition to
Delhi,
become
yes.
a scientist. And I have to go in research line. And I'm thinking of Harvard University.
Research.
Sir, sir, can you please tell the stages I have? Not stages really, but the exams I have to go through for the best subscriptions and scholarships.
About Harvard.
Yeah. All right. So
Yeah.
Harvard. Yeah. So Harvard. So it depends. You see, Harvard. I was in Harvard only for a few months because I certified my robotic surgery in Harvard University. Now that was because I had the skills in surgery, so I was able to go on ahead. But to start from the beginning, it depends on what you want to be, what scientist you want to be, what research you want to do, what you want to do.
Sir,
So,
I have to go
can
in
you specify that?
chemistry science, organic science.
Organic sciences or biotechnology or something like that is what you want to be.
Yes,
a scientist
sir.
with respect to vaccines, research and vaccines. So you see, that is a part of, is still a part of being. Pardon?
Carry on.
All right. Yeah. So that's still a part. That's still a part of your medical field. So you'd still want to get through MBBS, and then you got to specialize in possibly your in immunology, and also maybe in a little bit of microbiology. And once you, and sometimes put a specification on biotechnology. So once you get these aspects ready, then you have to, and you've crossed MBBS, you've got into your specialization, you'll probably want to do the USMLE in between, or before that. So some people want to do is that once they finish the MBBS, and in between that, their curriculum of 6 years, they would then write the USMLE exam. And the USMLE exam then allows you to study medicine in the US, which Harvard is in Boston, which is one of the cities in the United States. And they would then allow you only if you pass your USMLE, which consists of three steps: step 1, step 2, and step 3. Now, step 1 you can clear anytime. Step 2 is when you will have to go to the US and write the exam. It's a practical exam. And then step 3 is possibly also in the US. And then once you are able, once they agree that yes, you can come and study in the US and practice in the US, then you can apply for research projects in Harvard. So you have to go to Harvard, look for the Department of Immunology or the Department of Microbiology, or together combined. Then you've got to search to work in that department for a few years. So how do people specialize in these foreign countries is that once they finish their basic degree, which is in the MBBS, they then work in the field of interest. So if say someone wants to become a surgeon, they work in the surgical field for a few years and then apply for being a registrar in that field. So then only will you be able to get into the registrar program of immunology, and then possibly then work there and then finish off your course in 3 to 4 years. And then, of course, go into the development of vaccines, development of new medication, research on new medication for cancer. So all of these things happen there. It's either you go in for MBBS, specialize in pathology, and then go into immunology. That's what you should do. So I would say pathology is the more better field, and then immunology. Right.
Okay.
I hope that answers your question.
Anshul, thank you.
Sir, which quality do you think is the most important in a doctor?
Yeah. Which quality? There is no quality that's important in a doctor. You know, you should be yourself. I would say, in whatever you do, don't try to hide what you are. What you are is what should be seen forward. All right, and that's what makes you you. So don't look at any other quality. What I would also look as a doctor is then, of course, to be to not be demanding, be a little humble in your approach to patients, and always have an inquisitive mind to always learn new things. You may grow old, and as you grow old, you feel, oh, these new surgeries are not for me. But don't shut your mind even when you're at the age of 55 or 60. So you can never reach you can never say that I've completed my studies when you become a doctor. So you always have an inquisitive mind, you know, always wanting to learn more, always wanting to move ahead. So that's what I would say is an important aspect for a doctor. Be have an inquisitive mind, and most of all, be who you are. That's all.
Okay. Harnan Jot.
Good evening, sir.
Good evening. Who's this?
Harnan Jot from Bathinda.
Punjab.
From Harnan Jot. Okay.
Sir,
I have a pronounce it probably Harnan Jot, is it?
Okay.
Sir, which is the best moment in your life after becoming a doctor?
Harnan, repeat your question.
I didn't get that. Can you repeat the question?
Sir, which is the best moment in your life after becoming a doctor?
Which is
What is the best moment in my life?
After becoming a doctor?
What is the best moment, is it?
Yes.
All right, okay. Yes, Harnanjut. Yeah, well, you see, I can remember, first of all, clearing the exam to be a very important factor when I entered the medicine. I felt like that was the end of everything. I've done all that I should do before. As soon as I entered MBBS, I felt, that is everything. I don't need to work anymore. But then when I entered medicine and entered MBBS, I realized it's just the beginning of very, very, very long ladder. But yeah, we didn't give up. But the best moment I would say is when I because I'm an obstetrician and a gynecologist, the day I was able to conduct my first delivery of a baby, I helped the lady have a baby. That was and see the baby come out and deliver it to the mother who was so happy. I think that was one of the good moments in my life, and that's what actually made me become an obstetrician. And because I became an obstetrician, I then had interest in gynecology and now surgery. So that I would say is one of the best moments. But that's just one of the few. There's so many good moments in my life. I have had the ability to meet so many people, meet many friends in my college, meet many patients, and each patient, each success is a defining moment in life. Yeah.
Okay, Janvi.
Good evening, sir. My name is Janvi. I'm from Mumbai.
Yes, Janvi.
I want to ask that if
Mumbai?
you do not want to be a surgeon in medical field, so what you can be?
Yep.
Janvi, question is, if you are not a doctor, then what you can do?
Yeah.
Yeah, there's so many specialties in medicine, right? Just doing surgery is not medicine, all right? So you can be, in terms of medicine specialist, you can be a dermatologist, you can be a physician, you can be like the other colleague of yours who wanted to become a scientist or a research scientist. You could be a pathologist, you could be a microbiologist, you could be a dermatologist, as I mentioned there already. You could be a psychiatrist. So there are many other aspects which do not require surgery, in medicine. But so that's another factor. So you don't have to be a surgeon at the end of your undergraduation. So you have 5 years, 6 years to undergraduate. After that, you decide where you want to be. So you have to understand what you want to be. What is your liking? All right. And then decide, okay, you don't want surgery, okay, it's out. So many other fields are out. You can be a cardiologist, and the other person is still, you can be a radiologist, they just see the x-rays and the CT scans, and they help us as surgeons to make a diagnosis. So you can be that, So there are many other fields in medicine that doesn't require surgery. All right.
Okay, Ashish Thomas.
Hello, sir. Good evening. I'm Ashish from Mysore, Karnataka.
Good evening.
Sir, my question to you is, sir, how to choose
Yeah.
whether to go to medical or engineering, sir?
I didn't get that, Ashish. Can you just repeat that? There's a bit of muffling.
Ashish wants to know that how can I choose that I am able to become a doctor or engineer?
Whoa, that's a difficult question, Ashish. That's what you should know. What does your heart want you to do? What do you want to do? What do you feel in your soul that you want to do? I'm sure you must have seen the movie 3 Idiots, and I'm sure it's what what is depicted there is very important. You can't force yourself to do anything, because if you force yourself to do anything, in the long run, you will always be unhappy if you're forced to do something. So you must do something that you love and you're passionate about. All right. So if you're passionate about healing and you're passionate about helping others with your skill that you have in terms of healing and medicine, you should go for medicine. But if you're a person who's more interested in buildings and architecture or robotics or in any other field, and your passion is there, you should follow your passion. So I think the most important factor for you to decide to become a doctor or an engineer, you should have a particular passion. And just you need not have any passion to become a doctor or an engineer. Your passion can be anything. You can be an entrepreneur, you can be a fashion designer, you can be so many things in this world, as long as you follow your passion. That's what I would say.
Okay, very good. Next question from Khushi Rai.
Good evening, sir. I am Khushi Rai from Delhi.
Good evening.
Sir, my question is to you that you study in India and you practice in India. And you know Hindi also, as sir told us. So why you leave India and went to Australia? And in India also want a great doctor like you.
That's
That's a good question, isn't it? Yeah. What was your name again? I didn't get your name.
Khushi.
Why, sir?
Khushi,
Why
Khushi.
you?
Can I get you? Can I get your Kushi? Yes, Kushi. I got your question. I got your question. That's a very good question, Kushi. It's like I said, in life, you don't actually govern where you have to be. It's not up to you where you will be. Now, मैं हिंदी जरूर बोल सकता हूँ, बहुत अच्छे तरह से हिंदी बोल सकता हूँ. मैं थोड़ा टूटा फूटा हो सकता है, अभी इतने साल से बाहर है इंडिया से, पर फिर भी मेरा हिंदी काफी अच्छा है, समझिए ना? तो जो I'm also a believer in the Lord. All right, let me put it that way. I'm a Christian by faith, and I believe in God, and I believe that God determines where you go in life. Right? So I have always followed my heart and prayed before I always did a thing. And that's what has always led me to a particular place. It's not because I wanted to be in Australia or wanted to be in the US. I have worked in India before also. But when your heart tells you to go somewhere, you then follow your heart and you follow what the Lord tells you. So that for me, that's been the principle. So it's not because I wanted to be here. It's just because I'm following what I've been told. I'm a doctor, but I'm also have a spiritual side in me, which is very important. So you've got to have a spiritual side, and I believe in the Lord Jesus, who has helped me, who has told me you're going to be here, and that's how I'll be here. I'm here at the moment. So yeah, so I hope that answers your question. So you've got to follow what your heart tells you. All right, I think that's most important. It could be that you may land up in one of the smaller places in the world. It doesn't matter. I went to South Africa. South Africa is not a developed country, mind you. South Africa is also a developing country, and there's a lot of sickness there too. But somehow the Lord told me to go there, so I went there. In spite of being amidst a lot of crime, I still worked in South Africa. But that's what the Lord told me to do, so I was there. And then from South Africa, He sent me to Australia, so I'm here. I don't know, He may send me back to India again. I'll come back again. So yeah, follow your heart. All right.
Thank you, sir.
Tanveer Kaur.
No problem.
Good evening, sir. My name is Tanveen and I'm from Sri Lanka. Sir, I want to ask.
Yeah, where are you from?
Sir, I want to.
Delhi.
Sir, Srinagar.
Srinagar, sorry.
Oh, Srinagar. Okay, yeah.
Yes, sir. I want to ask that.
Go ahead, Tanveen.
Yes, sir.
Yeah, I can't hear you.
Carry on, Tanveen. Carry on.
I didn't hear your question.
Sir, after 10th, I want to pursue that in pure medical line. And if by chance there is in need, my marks are not so good. So what will be the other options for me?
Well, see, Tanveen, like I said, is it Tanveen?
Yes. Carry on.
Yes, sir.
Yeah. I mean, like I said, don't study for marks. Let's put it that way. Don't study for marks. I know all of us are in a competitive exam. That's what I don't like about the Indian way of going ahead in the career selection. We don't study for marks, right? Now, what we need to study is we need to study what you got to study. You've got to look at what you want to do, and if you are passionate about what you want to do, you will definitely make it in life. Don't give up, right? Now, there are many options in life. You can be if you're not a doctor, you can be anything in life, and as long as you're the top of the game and you're happy in it, that's what you should do. I don't say that if you can't do it, that the world has ended. It doesn't work that way. Doctors are not the only people who live in this world. You have a farmer. He's a farmer, but he's actually doing so much for the whole nation. Unfortunately, our farmers, some of our farmers in our country are not given that much importance, but actually they are one of the most important people, I would say. So you should follow your passion. So you can be anything in this world as long as you have the passion for it and you work to it. So if you don't end up being a doctor, it's not the end of the world. There's so many things. You can become an engineer, you can become an entrepreneur, you can become a very good teacher like Dr. Sanjeev here, he's teaching so many of you guys here, why there's an aspiration to be a teacher, isn't that a good aspiration? And he's doing a great job, and it's his passion. So you can be anything you like in your work, in your heart, as long as you have a passion. So don't say that everything ends after one thing, all right? So there's a lot of options open in this world. You can be a fashion designer, you can be a good mechanic and work in Mercedes Benz as the best mechanic, and that's still a big job, So don't lose heart, all right? Look at what your heart is telling you to do, I would say, all right?
And Basil, here is another girl from your side, Anushka. She wants to know something. Anushka,
Good
carry
evening,
on.
sir. Good evening, sir.
Anushka.
Sir, I want to ask that is medical line good for that those who are not able to give more time to science and they are not that much good in science but they want to become a doctor, so they can.
Well, you see, unfortunately, if you want to become a doctor, you've got to have a little bit of science background. You've got to have your physics, chemistry, biology as your core subjects when you are actually preparing for your NEET. I'm sure that it is. And of course, if you want to go to the engineering aspect, you've got to have mathematics. But yeah, I mean, it is a good subject. I mean, it is very important to have science as a part of your core subjects if you want to become a doctor. But you can be a doctor of anything, So you can also be a doctorate in psychology, a doctorate in mathematics. Like if you do a PhD after doing mathematics, you're still a doctor. You're still getting a doctor degree, although you're not healing patients. But yeah, that's another field. But if you want to go into medicine, you've got to have science as physics, chemistry, and biology as your core subjects, unfortunately.
Okay, Dipanshu.
Yeah.
Dipanshu.
Good evening, sir. Good evening, sir.
Dipanshu.
Sir,
Good
my
evening.
question is, sir, how can I prepare myself at this age to become a doctor?
How to prepare yourself to become a doctor? Yeah, see, like I said, Dipanshu, it's in your if you have the passion to become it, you will become it. You've got to in India, I believe it's a preparation preparation that starts way ahead. If you have to get into those entrance exams and crack it, you've got to start preparing way ahead. Some people would start even at in class 10 or even class 7, 8. You just have to direct yourself what you want to do in life. In class 10 or 11, you probably have to take your core subjects as physics, chemistry, maths and biology, which is going to be your core subjects for you to prepare for your entrance exams. And of course, in India, it's unfortunately entrance exams that you've got to give for getting into a particular college degree. Now, in abroad or any other country, it's not absolutely necessary that you have to have these core subjects. People can do different other subjects like social studies and arts, excuse me, and then decide to become a doctor later on, and then they'll have to reinforce themselves with the science subjects. But yeah, in India, it's imperative that you should have physics, chemistry, and biology and mathematics as an alternative subject during your core 11 and 12. And then of course you've got to also prepare using, I mean, in India we have other tutorials and all of that. I did some of those tutorials when we were there. I did some of the private tutorials for the entrance exams. And yeah, and then of course give their entrance exams and get into your preferred college that you would like to study medicine in. And then that's
Anushka.
your beginning of becoming a doctor.
Okay, Anushka.
Good evening, sir. Good evening, doctor. I am Anushka from Delhi. So my question, there are two questions. So my first question is, nowadays we are going with online studies and we have to be in front of screen for 4 to 5 hours. Sir, so how can we protect our eyes? So my second question is, I want to be a neurologist. So my second question is, I want to be a neurologist. So what can I do to become a neurologist?
Yeah. Great. So, I mean, yeah, Anushka, unfortunately, of this new scenario, there's a lot of online teaching that's happening. I'm sure even my kids have gone into online, but I would actually advise most of the people that it would be, I wouldn't advise it, but I hope that we can get over this COVID crisis and come out of the online teaching and go back to the way we were being taught before, where we don't have to sit in front of the screen. The screen definitely can harm us. A lot of people are being reported to have a decreased vision because of this. You can use a screen protector in front of your monitor, but it helps. It does affect our eyes. It also affects neurological cells. So, and sometimes there are a few studies that have reported the higher incidence of neurological tumors in certain people because of increased exposure to screen time. So there are a lot of defects that can happen because of increased exposure to screen time, especially with the new generation coming up. All our children are always just being exposed to tablets and phones, and some of them can have cognitive disorders. They can have the inability to keep themselves in balance and all of that. So these are a few problems that can happen with increased screen exposure. So I think it's better to have lesser screen time. That's always good. Try to limit your screen time to 4 hours to 5 hours a day. That's it. You know, that should be, that's it. Avoid your too much social media. That would be a good thing. But if you have screen time and as a student, use that screen time mainly for learning. Now, to become a neurologist, again, the pathway is become a doctor first, an MBBS doctor, do your undergraduation. After undergraduation, you got to write your entrance exam for become an internal medicine specialist, like your MD in internal medicine. After you get your MD in internal medicine, then you have to subspecialize in neurology. So that's a DM in neurology. So that's another entrance exam. So 5 to 6 years of MBBS. So you have 5 years of MBBS, 1 year of internship. After 1 year of internship, you study and become for your MD in internal medicine, which is another 3 years. After you finish your MD in internal medicine, you give another entrance exam, and then you become a DM in neurology. All right? Okay.
Rekha.
That's how it is done.
Okay, Rekha.
Hello, good evening, sir.
Yeah.
So Rekha calling from Srinagar. I want to ask two things. So, when did you realize that you should become a doctor and go beyond India to pursue your career and profession? And second thing was similar to Khushi Rai. Why did you left India? Don't you remember your motherland? Thank you, sir.
Yes, I do. Yeah, let me answer your second question. I remember India almost every day, you know. But thank God I'm in a city in Australia where we have a lot of Indians. I'm staying in a suburb in India, in Perth, which has so many Indians that I almost feel like I'm in India, you know. So we have people from all over the world, and all over part of India staying in this place, and I don't really feel that I'm out of India. But I do remember my homeland explicitly every day. I remember my family, and yeah, that's something I miss. But unfortunately, the Lord has told me to stay here for now. Hopefully, maybe when I'm older and I don't have any more responsibilities for my children, and I hope they are big enough to handle themselves, then I can do what I want, and if the Lord will be taking me back to India, and I'll come back to India. You know, hopefully that's something that I can't say for guarantee. But the first question was to I'm forgetting your first question. What was your first question again?
So first
Can
question
you
was,
repeat your
when
first
did
question?
that you should become a doctor
Oh, when,
and go beyond India?
yeah, when did yeah, sure. Yeah, sure. When did I first decide to become a doctor? And that's a very difficult question because, yeah, I was like any one of you, going through my childhood years, enjoying every bit of it. I tell you, I was in a boarding school since the age of since the age of 4. I hope you know what a boarding school is, where you're away from your parents and in boarding from kindergarten. That is your जब आप सबसे छोटा बच्चा है तब से हमें बोर्डिंग स्कूल में बोर्डिंग स्कूल में था तो जी
many students ask now you can speak Hindi.
Yes. Okay, sure. I'll try to speak Hindi. मैं जब से छोटा था तो मैं बोर्डिंग स्कूल में पढ़ता था in Darjeeling, Kalimpong. तो तब से मैं अपना कोई हिसाब किताब नहीं था कि मैं डॉक्टर बनूंगा कि क्या बनूंगा. जब मैंने देखा कि मेरा भाई डॉक्टर बन रहा था तब मेरे ख्याल में आया था कि भाई मैं जिंदगी में क्या करूंगा. Then I would keep it that fate led me to become a doctor. But yes, my brother was a role model for me to become a doctor. And I said, okay, I'll follow his steps and see, because he seems to be happy in what he's doing. उसको खुशी आ रहा था कि वो डॉक्टर मेडिसिन की लाइन में चला गया था, इसलिए मैंने भी सोचा चलो मैं भी पढ़ लेता हूँ. जब मैं घुसा था and I prayed about it and I was successful, then it slowly moved me to move ahead, you know. So every step after that has always been a motivation from the heart. All right. Okay.
Krishna. Basil, Krishna, carry on.
Yes.
Good evening, sir.
Yes, Krishna.
Sir, there was sir, तो सर तो हमको सर ईयरफोन्स पहनने पड़ते हैं, तो सर वो हमारे कानों को सर हार्म तो नहीं करेंगे ना?
Basil, Krishna wants to know that
it depends. Yeah.
Is it safe to wear earphones?
Yeah, see, I mean, the earphones also depend on what type of earphones you are using. Some of the earphones built these days have sound silence, like the Bose one that I'm using here. They have sound. It's called they silence the surrounding, and therefore they protect your ears somehow from the vibrations, from very severe vibrations to go in. All right. Now, some of the earphones don't have that controlling capacity, and therefore they can damage. They can damage your eardrums. So you should be very careful in the earphones that you use. All right. But having said that, some of the earplugs also, they can corrode the skin inside, and they can cause some infection also. So you have to keep your earphones always clean and in a safe place, I would say. And if you can get a good earphone like the one that I'm using, some of them have sound silence in them, so that helps in it protects your ears from too many vibrations. So it's a good thing to get, you know. Avoid getting any low-cost one, because that can just doesn't hamper the amount of sound waves that can come through. Yeah.
Basil, one interesting question: do you like Hindi movie?
Lots of them. I've seen each and every Hindi movie so far.
A student asked, can you name some of the movies' name?
Well, I saw DDLJ almost 14 times in my life.
Okay.
So, I hope you know what DDLJ is. Dilwale Dulhaniya Le Jayenge. I saw it 14 times when I was in college. I bunked my classes to go and see it.
And what is the latest movie you have seen? Which one?
The latest movie. Let me see. The latest movie I just saw recently was, I think it was Sushant's movie. I'm sorry that Sushant lost his life. He took his own life, but it's one of Sushant's latest movie with what's this girl's name?
Shishore.
She. Is it?
Shishore.
Is that one? I don't know. I forgot. Shishori, not Shishori. I think I've seen the latest one I saw with my daughters, but I saw ABCD2, and then of course after that I saw what's it called? Manakarnika.
Manikarnika.
Yes.
Okay.
Manakarnika. Yes.
Artisha.
Sir, what do you do in your leisure time?
Pardon?
Archa, repeat your question.
Sir, what do you do in your leisure time?
What are you doing in your free
What I do
time?
in my leisure time. With my in my free time, in my free time, I'm trying to spend a lot of time with my children. You know, I try to when you become a father, the other time is to spend a lot of time with your kids. So you try to teach them things about life, try to take them out, try to have a good go biking. So I go cycling. I go. I do a lot of what do you call that? A lot of listening to music. I listen to a lot of music. So these are a few things that I do. But at the moment, I always try to spend time with my kids and make sure that they're doing that. They're also if I can contribute something to them in their questions, I try to listen to them. So I keep listening to my children every time in my leisure time. Hopefully they'll be able to ask me things, take them out. You know, that's what I try to do. Yeah. Take care of this fellow. I hope I meet. His name is Billy, so I take care of him also.
Basil, one interesting question कि आपको किसी पेशेंट को ट्रीट करते हुए कभी डर लगा है? इन हिंदी कभी आपको ऐसा महसूस हुआ है कि आप डर गए हो किसी पेशेंट को ट्रीट करते हुए?
बहुत बिल्कुल बहुत से किस्से आए थे मेरे जिंदगी में जब मैंने सोचा कि मुझे बहुत डर लगा जब मैं पेशेंट को ट्रीट करते हुए, स्पेशली एज अ ऑब्स्टेट्रिशियन जब हम ऑपरेशंस करते हैं, सिजेरियन करते हैं और जब आप देखते हैं एक कंडीशन होते हैं हमारे ऑब्स्टेट्रिक फील्ड में जिसको बोलते हैं प्लेसेंटा प्रीविया और एब्डोमिनल प्रेगनेंसी. ऐसा प्रेगनेंसी होता है कि it's not in the womb. I hope I can use that term. It's not in the womb. It's not in the uterus, but it is outside of. It's in the stomach of the mother. Not in Hindi they call it bachadani. I think so. All right. Okay. So it's outside of the pregnancy. It's outside of the uterus, and that lady was bleeding so much. So, and I thought that yes, we would be losing her. So that's a fear. And of course, I have had patients who have not made it. Even when on the operating table, so it has happened like that, you know. So there's a lot of fear in certain aspects of your patient, but you overcome that fear by praying. You pray before you do anything. I always do that. All right.
And
that gives you more strength.
One more question: which kind of patient irritate you? That's the question from student.
What kind of patient?
What kind of patient irritate you? Are you irritated from the patient?
Irritate me. Well, I wouldn't say I get irritated from any patient. No, I wouldn't say it. Sometimes everybody has their own days. There are some days that you are not really happy. You have a lot of issues and you have a lot of pressure, and so that's the days that you get irritated because of some other problem, not because of your patients, and then you throw it onto your patients sometimes. But I would say you shouldn't do that. You should always be respectful of your patient, because your patient is actually the person who's actually teaching you a lot. So I wouldn't say I've been irritated by any patient, never at all. At the moment I would say I'm happy treating all patients. Yeah, and I like chatting, so they like chatting with me too. So that's a good thing. If you can chat well, every patient is good.
And one question from another student, Ajit. He wants to know कि किसी ने आपको ऑस्ट्रेलिया में रिश्वत देने की कोशिश की है कि मेरा ट्रीटमेंट बढ़िया कर दीजिए and take this extra money.
Nothing of that sort happens there. Yeah.
Okay.
Nothing of that sort happens in me. I've never had that situation come up in my life. It has never happened, and doesn't happen here at all.
But in India, we can do this. Isha.
I don't know what happens. I can't comment. No comment on that aspect. But I don't think so. Yeah,
Okay.
it's no comment from me.
Isha.
Yeah.
Isha, carry on.
Good evening, sir. So I am Isha Singh from Punjab, from Bathinda, Punjab, for COVID-19 something. So, so what do you think that this COVID-19 virus, is it a man-made virus or it's a natural virus?
That's also something I can't comment on social media, you know. It's a big controversy, you know. Whom do you,
Isha,
whom do you believe?
Yes,
Yeah.
yes. Isha, doctor cannot comment on this. Sorry
It's a
for
big,
this.
it's a big controversy. I
It
cannot
can,
comment on that.
yes, yes. It can
Yeah,
create a controversy.
But yeah, what I can tell you, yeah, I can tell you is that you should just be safe and follow all the principles to keep yourself safe and your family safe. That's all. All right.
Sneha.
A very good morning, sir. I'm Sneha from Gandhinagar, Gujarat.
Evening, sir.
I want to ask you that
Yeah.
is it very much necessary to crack the MBBS to become a good doctor?
Unfortunately, yes. That if you want to be a doctor who's going to be treating patients, you will have to do the MBBS. You have to go through MBBS. That's for sure. So and of course whatever that
If I
happens
want to be
before
a
that.
psychologist,
So all of that is necessary. If you be a psychologist, yeah. If you want to be a psychologist, you need not have to be. You need not have to go into medicine. You can just sometimes psychology as such is a separate subject in arts as such, which can be taken up, and you can do psychology without becoming without doing MBBS. That's for sure.
Basil, and message to my student, and at the last message to all the students, because they all are a future doctors, want to become a doctor.
All right. Okay, good. That's great. I mean, I can see just a few here, but I'm going to scroll down and see all of you guys here. Yeah, everybody. I mean, I'm sure. Like I said, in life, if you want to do something, you should aspire to do it, and always keep that at the bottom of your heart, saying, "This is what I want to become." So follow your heart and do what you feel that you're going to be happy doing for the rest of your life. If you can see yourself in 20 years that you're a doctor and you're going to be happy there, you should do it. What I can tell you is you can sometimes fail. Like for example, I never cracked or I never got into medicine with a straight shot. Unfortunately, my wife is more intelligent than me. She got everything into the first shot, you know. Unfortunately, me, no, I'm not that intelligent, but I always took failure as a pillar to success. So it was a stepping stone to success. If you fail, it's not the end of the road. Try again if you feel that's what you want to do. And even after crossing medicine, when you get into the fact that you want to study, you specialize, then too it's a big battle. So you still have to do a lot of there's a lot of competition there too. So you've got to stress yourself, saying that I'm going to make it. And if you fail, go on ahead. All right. And I'm sure all of you will be brilliant people in whatever field you do. All right. I'm sure you'll be brilliant in everything that you do, and never demeanor any profession. Every profession has their pros, all right? And you should try to be the best in whichever profession you take, all right? I'm not saying this because as a doctor, if you're a doctor, be the best in your profession and keep the core of that profession in your heart. So as I said, patients are the core in my heart. So for me, the good outcome of a patient is the most important thing. Similarly, for Sanjeev, a good student is a good outcome. So he's got all of you here. For him, his passion is teaching, and that's why he has so many of you here listening to him. All right. So that's something commendable. All right. So you got to have passion for what you do. All right. And of course, the most important thing is, I would say, pray. I pray. All right. For everything that I do, you pray and ask spiritual well-being of what you want to do. Keep everything in prayer. It's very important also. All right. So I would keep these three things very important. All right. Your passion, your prayer, and of course, do not demean any profession. You will always be the best in whatever you do as long as you follow your heart. All right.
Okay. Okay, Dr. Basil. Thank you. Thank you for sparing time. And many of my students asking us, Dr. Basil is a good singer, and if he can sing one Hindi song or 2 or 3 lines for us. And
all right. Which song should I sing? Okay. जिंदगी की सफर में जो चलना है मकाम वो something.
Thank you.
Yeah, I don't know the full words again. That's something I can tell you. It's a very old song, all right? But yeah, that's something I'll do.
Okay,
Thank you so much. All right.
Thank you.
All right.
Bye bye.
God bless you all.
Now we are
And,
going to end the meeting.
I wish you all the best, everybody. Bye bye.
Okay, thank you. Thank you, students. Now we are going to end the meeting.
Bye. Bye bye.